right, so we're gonna talk about push therapy here. We're gonna combine the 360 balloon breathing with, on the exhale, we're gonna focus on really bearing down and pushing. So first thing, we're gonna connect to the 360 breath. So seeing if we can get that side to side, front to back expansion. As we do a few of those breaths, seeing if we can get the breath to travel all the way down to the pelvic floor. Remember, imagine a flower blooming open inside of that vaginal and rectal opening. So inhaling, allowing the breath to come down, blooming open that flower. And then on the exhale, bear down like you're having a bowel movement or you're passing gas. So we're going to bear down, and then on the inhale, relax. 360 breath, pelvic floor expansion, balloon breathing. Exhale, bear down. So practice this in different positions. So starting on your back, you can even practice in that push position where your knees are in. So that's internal rotation of the pelvis. You can also even elevate your sacrum on that towel, like we had mentioned. So you're in that pushing position. Also, if you plan potentially on giving birth in the sideline position, practice it on each side. If you have a peanut ball, awesome. If not, no worries. You can put a pillow between your knees, and same exact thing here. Practice a few of the breaths, seeing if you can get the breath into the pelvic floor. And then when you have that down, on the exhale, bear down. Push, 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 push. Good. Inhale. Relax. And then don't keep your knee up. I'm just pretending I have a pillow between my knees, so don't be lifting your leg up, okay? And then lastly, a great position to try this in is in the tabletop position. And so again, most important thing is that connection to the breath here into the pelvic floor. You can try this in different positions. You can even get into that child's pose position by really getting into various positions, working that breath, and then practicing that push. Push, 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 push. And then on the inhale, super important to relax, get a deep diaphragmatic breath into the pelvic floor. And yeah, so a quick reminder, remember the uterus can do 80–90% of the work. It's really about relaxing the pelvic floor. If you're able to help baby come out with that pushing, that's awesome. But again, the most important thing is to learn how to relax balloon breathing to that pelvic floor and reduce some of that tension that we're having.